And this is a time to set big goals, to pursue them with courage and conviction, because the health of the nation is literally at stake.
The message from President-elect Joe Biden Friday as he unveiled his incoming administration's 5-step plan to deliver 100 million shots of the COVID-19 vaccine within the first 100 days of taking office. It includes expanding who gets first access to the vaccine, utilizing pharmacies and mass vaccination sites, and ramping up production.
We'll use the Defense Production Act to work with private industry to accelerate the making of materials needed to supply and administer the vaccine.
Meanwhile, much of central Virginia is set to move to Phase 1B of the vaccination process Monday. The Richmond, Henrico, Chesterfield, and Chickahominy districts will open up to the first 3 groups of essential workers and people over the age of 65. They're partnering for 3 mass vaccination events at the Richmond Raceway for teachers and first responders. These are by appointment only, and they're asking people not to show up unless they have one. Meanwhile, Friday, Richmond and Henrico released additional details on how the other groups will be reached, including mobile vaccination clinics for correctional facilities and partnerships for homeless shelters, while the 65-plus group will be through vaccination events, primary care providers, and pharmacies. They said they are on track to reach the rest of 1B by the end of the month.
About half of Virginia is now eligible to receive the vaccine. That's a major logistical effort.
Statewide, Governor Ralph Northam said Thursday all of Virginia should be in 1B by month's end as he announced changes to the rollout, moving up certain groups into that phase. It followed a federal announcement Tuesday where officials announced they'd also release all reserves of the vaccine held for second doses. It was welcome news by Northam as he seeks to vaccinate 50,000 Virginians a day. However, a Washington Post report Friday says those reserves had already been released and states would not see an increase to their weekly shipment.
Now, we have reached out to the U.S. Department of Health and Human Services for comment about this. Meanwhile, the governor's spokesperson released a statement saying that they were told explicitly on Tuesday that they would receive additional doses and adjusted their vaccination plans based on that. They said that they are trying to gather as much information as possible about this so that they can plan accordingly.